In the last video, we met Meera, a 73-year-old woman who has been diagnosed with osteoporosis and had a spine fracture. She was afraid that her high fracture risk would affect her social life and make her a burden to her family. Fortunately, her doctor recommended some steps to gain balance and strength. Meera didn't like the idea of exercising, as it wasn't something she had ever done before. But after learning how to add some simple exercises into her daily routine and seeing the difference it made, she has gained the confidence to try an exercise program recommended by her doctor at her local YMCA. Not all exercise instructors have the same training. There are training programs that teach instructors how to choose or modify exercises for people with arthritis, osteoporosis, and other conditions. It is a good idea to find a class where the exercise instructor has training related to osteoporosis. Tell the instructor about your osteoporosis before you start the class. Here are a few tips to keep in mind to maximize your enjoyment and minimize your risk of injury during your class. Exercising with a friend will make it more fun. Plus, it will help you to get up and going when you might not feel especially motivated because your friend is depending on you. Pick a class that you can go to at the same time each week to make it a habit. Have a backup plan for days you can't make it. Check off the days you exercise on a calendar. It helps you keep on track. Choose exercises where you can keep your back straight or bend at the hips instead of the spine. Avoid or modify exercises where you have to bend or flex your spine, especially if you're bending all the way forward, bending repeatedly, or bending while holding weights. For example, sit-ups or crunches are not a good idea because you have to bend your spine. Bending at the hips may be okay if you are keeping your spine straight. This is called a hip hinge. Start by standing up straight with good posture. Then, place your hands on the crease of your hips. Bend at the hips, sticking your bum out slightly while keeping your back straight. You can use a hip hinge to do a squat or when picking something up off the floor. Twisting causes muscles to pull hard on the bones of the spine and should be avoided, especially if you are twisting all the way to the side, twisting repeatedly, or twisting while holding weights. For example, yoga postures that involve spinal twisting are not good for people with osteoporosis. Gentle twists done while lying on the back may be okay. How you get into position for exercise is important too. If you need to bend and twist to get into an exercise machine, maybe try an alternative. Lifting weights overhead or out in front of you can overload the bones of your spine. For example, an overhead press requires you to lift overhead, and a front raise has you lift weights out in front. Holding weights on either side of your body is a way to balance the weight and minimize the loads on your spine. These few simple tips can help you stay safe and make the most out of your in-class experience. What will you add to your exercise action plan right now? Call and tell us about it, or post a note or picture on Facebook or Twitter with the hashtag #TooFitToFracture.